Our next speaker is Vice President of Provider Engagement Strategy for Anthem, Inc., and also General Manager of Live Health. John?
Hi there, and thanks for having me on as well. Appreciate being in such great company, talking about something. I feel like we're, in a way, we're all singing from the same hymnal, which is probably a very healthy thing to do right about now. So I'll talk to you a little bit about how telehealth is being deeply integrated into the payer, in the example of Live Health Online. So I've been with Anthem for 21 years and just sort of saw this technology emerge about 4 or 5 years ago. We're working with a company, American Well, that actually created the technology. And for years, doctors have said, why don't you pay us for telephone visits? A lot of work on the phone. And, you know, as payers, generally, we've said, well, we really don't know what happened on the phone. Was it a 5-minute call? Was it a 30-minute call? You know, is there documentation? Was there a prescription? So finally, coming to technology that really creates all those things that go on in an office visit, including the live video communication, but things like ICD-9 codes, CPT coding, clearly identifying the patient, identifying the doctor, so that from a health plan perspective, yes, this makes a lot of sense. We really should make this a covered benefit. It does 3 things that we're all trying to do. It improves access to care, it makes healthcare more affordable, and it improves the consumer's experience. And so we have really 2 business approaches to this. One is the urgent care in a cloud that you've heard some about on this call already, and that's really when your doctor's not available. Because there are times, whether it's Friday night at 10 o'clock or morning at 7, when you know your doctor just can't be available all the time, or you're out of town, out of state. And so that's Live Health Online, which is this. Within an average waiting time of 10 minutes or less, right now around 3, you can be face-to-face with a board-certified doctor in high-definition video on a smartphone, tablet, or computer, or if your employer has offered a kiosk, and have a visit. And that visit can include a prescription, depending on the state that you're in. There's a full-blown map on livehealthonline.com, which is, I know, one of the challenges we're all dealing with. So right now it's live in 44 states, 24 hours a day, 7 days a week, 365 days a year. So that's what it is. We've been working in collaboration with medical boards in many states. I've personally been probably in 25 or 30 medical boards, helping them modernize their rules on telehealth. We're also, as many on this call, active in Washington as well. We are co-owner of a national telehealth provider group management company. We realized early on that to provide real urgent care 24/7 across the country, a few hours here from a doctor who had some spare time was not going to do it. So there's a dedicated medical group of doctors who practice telehealth for a living now, and many of them have multiple state licenses to deal with that issue, and they're handpicked and groomed and trained for telehealth. So it's really the Net Promoter Score and all the things mentioned in the past, and Dr. were are very positive. People love it, especially the mother who's busy on a weeknight. It's 9 o'clock at night. One of the children have a rash, and she's trying to figure out whether or not the next day to get a pediatrician visit, pull the child out of school, call herself out of work, and make it all happen. And then she finds out that she can download a free app or go on the web and within about 15 minutes have it all done. Those are the raving fans, and so we're happy for that. But what we saw as a health plan was this really should be a covered benefit. So we integrated it. Let me advance the slide here for a second. So we knew that it had to be paperless for it to really work well. So the first thing that happens when you go in is it checks your insurance eligibility benefits in real time, and it'll come back and know whether you're covered and if you have a copay, and it'll only collect that on your credit card. The deductible hasn't yet been met. So it'll take care of that and charge you the appropriate amount, and then submit the claim electronically to the health plan in the background after everything's done. That was really important. Other ways to integrate it with the health plan to help employers really get optimal value is tying it to things like the 24-hour nurse line. People call the nurse line, they're automatically usually calling for a reason, not feeling well. That nurse may detect that they need to see a doctor. Again, their doctor may not be available. Rather than have it wait till morning, if they can get them connected to Live Health Online, they can get them a visit right away, and that's been very successful. After the visit's over, the patient, for continuity's sake, with one click can forward a summary of the visit to their doctor, or they can download it and print it or save it and access it anytime they want in their Live Health. Mobile was really a big deal, as all of you on this call I'm sure know. Started out with the web, but about a year and a half ago, we introduced mobile app on Apple and Android devices, and now really more than half the visits are on mobile, and that continues to grow. The other thing people are able to do is fully integrated with the Apple Health app. So if you're tracking glucometer readings or other clinical biometrics and storing them on your Apple Health app, when you go to see a doctor, you're able to, with one click, have that information uploaded and it's made available at the time of the visit for that doctor to have it handy. I think as more and more app makers start to write useful apps to the health app, that'll increase it in value. We'll all see how that goes. We've seen this growth. I think 2014 was the year of awakening telehealth. 16 million Anthem members will as a benefit by the end of 2015, and 20 million by the end of next year. Nearly 60% of large employers with Anthem will have it as a benefit by 2016, by the beginning of next year. So again, the integration and covering it as a benefit was really important. In 2012, Anthem was the first health plan in the country to offer these visits as a covered benefit, and we offered it to all fully insured and self-funded members, including exchange members, with a rollout that began then. And then since then, in 2011 of this year, offered it as a benefit to senior citizens in the Medicare Advantage program in 12 markets. So even though traditional Medicare does not yet recognize this type of telehealth as a benefit, and I know there's a lot of conversation going on, we didn't really want to wait and kind of withhold this for seniors who may find it very convenient. And so as a supplemental benefit. And there will be expansion of that coming in 2016 with more senior advantage members and markets. As far as large clients, employers, we all can remember about years ago, this started out as a couple of questions maybe in a request for proposal. Now there's, full-blown 200-question telehealth proposals that come out, or requests for proposals. So there's not an employer today who at least hasn't heard of it. But of course, there's a spectrum, and those that apply the energy to help their employees adopt this and make use of it, find that they find healthcare savings that come from it. That'll only increase. It's going to be just a matter of a few years, and this will be as common as a retail clinic and anything else. There's a second part to this, and that's the provider strategy, a little bit similar to what you just heard, and this is enabling the doctor to empower their own practice and make it web and mobile enabled. So we're working with practices, predominantly patient-centered medical homes and ACOs, to let them set up a private storefront, have functionality to invite their patients in via email, and to offer themselves on web or mobile to their patients. And again, the use cases go beyond after-hours care, really get into managing chronic disease, and avoiding unnecessary travel and waiting room inconvenience, especially for seniors that have trouble coming and going from the office. So in short, the provider version, Blue plans in particular, to really empower the ACO and the patient-centered medical home model with a powerful tool. And it also helps the physicians. There's incentives for them. It helps them to power them do better on their gain share. We're we've commissioned a company called HealthCore, which is actually an Anthem subsidiary. It's a health analytics company to do a thorough study, and we'll have that published probably in the fall, and that'll be looking across all the patients that have had visits and used telehealth, and then looking at all their claims data in relation to it, and drawing conclusions about quality and about cost and so on. So that's a real quick overview. Again, it's John Jesser, and I'm happy to answer questions after we're done. Thank you.